Nicole Cornay. I'm a fourth-year medical student at Rush Medical College. This is a poster presentation on the association between dilated cardiomyopathy and methylphenidate. So for some background, heart failure due to idiopathic dilated cardiomyopathy is rare in younger patients. These patients are often found to have genetic linkage or cytotoxic drug exposure, and while cocaine and amphetamines have a known correlation to the development of dilated cardiomyopathy, methylphenidate does not. So we report a case of a young man with Fragile X syndrome who develops heart failure with reduced ejection fraction after long-term methylphenidate use. So this is a 41-year-old male with Fragile X syndrome and obesity. He's admitted to the general medicine floor for an acute exacerbation of chronic heart failure. He had previously been taking methylphenidate 20 milligrams 3 times daily for decades prior to hospital admission. Upon heart failure diagnosis 6 months prior to this admission, methylphenidate was discontinued as other stimulants have been implicated in the development of dilated cardiomyopathy in otherwise healthy individuals. So this patient was diagnosed with combined diastolic and systolic heart failure 6 months prior to presentation. TT at that time revealed biventricular dysfunction, left ventricular ejection fraction of 20 to 25%, severe dilation of all 4 cardiac chambers, mild aortic root dilation, and mild to moderate mitral valve regurgitation. He was started on GDMT therapy for New York Heart Association Class 2 to 3 Stage C HFrEF, likely secondary to non-ischemic dilated cardiomyopathy. These images below are the echo findings from his hospitalization 6 months after his original diagnosis, and they show a severely dilated heart. So Fragile X syndrome is commonly associated with well-defined cardiac abnormalities such as mitral valve prolapse and aortic root dilation. Over 55% of patients with Fragile X have MVP, and roughly 20% of patients over age 18 have abnormal aortic root dimensions. However, there's a lack of literature describing the prevalence of patients with Fragile X who are diagnosed with heart failure with etiologies other than MVP or aortic root dilation, as seen in this patient. Ultimately, methylphenidate was pursued as the cause of this patient's heart failure. Methylphenidate is a CNS stimulant that increases the release of catecholamines and blocks their synaptic reuptake and degradation. Circulating catecholamines activate beta-1 and alpha receptors, leading to increased systolic blood pressure and heart rates. Both are risk factors for adverse cardiac events when elevated. While there's conflicting literature discussing the specific adverse cardiac effects associated with stimulant use in the adult population, multiple studies have confirmed that there is a statistically significant increase in systolic blood pressure and heart rate in both adults and children on long-term stimulants. Though these changes may seem minimal in healthy individuals, there are no guidelines to identify patients who are at a higher risk of developing cardiac toxicity from stimulants. For this patient, obesity is associated with increased sympathetic nervous system activation and hyperdynamic circulation with increased cardiac output, thus amplifying the stimulant CNS response even further. While this may represent one possibility, further research needs to be done to properly identify those who may be more prone to experiencing these cardiac